Welcome to the Dr. Stacy Show, where we're talking about all things faith, love, and wellness as it relates to raising kids. I'm your host, Dr. Stacy, and today I'm super excited to have with us Lyric Townsend. Lyric is a licensed speech language pathologist based in Greensboro, North Carolina. Lyric earned her Bachelor's of Science from the University of North Carolina, Greensboro in 2020, and her Master's of Science in Communication Sciences and Disorders from Western Carolina University in 2023. She holds a certificate of clinical competence from the American Speech Language Hearing Association, and she is also the founder of Sound to Soul, a platform dedicated to empowering communication through meaningful connection. Sound to Soul provides evidence based resources, education, and advocacy that help support awareness around speech and language development disorders. Lyric, thanks so much for being part of our show today.
Thank you. You made me sound so nice. I know I sent you that, but the way you read it, that was beautiful. I'm like, who
That's the
is
host job.
this?
That's the host job. Listen. You are the expert. I have been for this show, and even as we were talking in the pre-show, that's because I work with speech and language pathologists all the time as a mental health therapist who works with children, and so I understand the importance of this space. But not many parents recognize until they need to send their child right for speech and language.
That-
But talk to my audience, I guess, a little bit. First of all, what is a speech and language pathologist? What do you do? And when should we see one?
yeah. So a speech language pathologist has a vast variety of services that could be provided to children or adults, people across the lifespan. Personally, I work for and work with pediatric clients, so the kiddos, which I love doing. Um, but there are 9 big areas where speech pathologists are able to treat and evaluate. Those are speech, language, cognition, communication, pragmatics, and I'm blanking a little bit on the exact order, but those are the types of areas that speech language pathologists cover, especially also including voice disorders.
Mm.
Yeah, that's one that people typically don't think of when you're thinking about a speech pathologist. Yeah. And another one that people don't think about a lot is swallowing and feeding disorders as well.
Picky eating disorders. Interesting.
Mhm.
Yeah, it's related to speech. Okay, see, and this is why I wanted you on the show because this is the
Yeah.
stuff we're going to dive into. So I know for me particularly, and one area you just mentioned, pragmatics, right? I definitely will pick up on that very early with children, especially if I'm suspecting autism as a diagnosis. And I
Mhm.
know oftentimes, depending on what state you're in, speech and language pathologists help me in even the diagnosing of autism based on language and based on what we hear, because usually it's the
Right.
pronouns, it's not being able to have that social reciprocity and conversation and things that we pick up on. Um, What's the youngest age that you've seen as a speech and language pathologist?
So within my career, I've been serving since 2023 as a speech pathologist. Um, And the youngest that I personally served is a 12-month-old, so right at that 1 year mark.
And what are you picking up on a little one that young? What should people be looking for? Even when we think about speech differences, what should people be listening for
Mhm.
a 1 year old?
Yeah, so it starts a lot of times with those early signs and signals that we're getting before a child is even saying their words, or and
Mm.
sometimes we do get kids a lot of most of the time. I'd say we do get kids after they've already gotten to the point where they're not speaking yet, but then they've already seen some of those signs beforehand.
Mhm.
So we have early intervention is key. And one thing that's very common to look at, especially at that 1 year age, babbling, the kids being able to follow along and see if they're attending to certain verbal or auditory sounds and stimuli within their surroundings, and just some of those social things that we don't think about at that age, like, have I seen my 1-year-old have a social smile or things of that nature. So it's
Yeah.
just a lot to think about, and a lot.
Mhm.
I'm not a parent yet, but I feel like it could be a lot to worry about as well.
Yeah.
That's why we're here.
Yeah. Well, and one of the things you just said is really key, like that baby that's way too quiet, right? And so
Mm-hmm.
it's a good baby, and but we've got to make sure the baby is making noise, right? There should be
Yeah.
some goofing and babbling and smiling and right, the baby that just doesn't have facial expression or
Mm-hmm.
always looking a certain way every time you see them could be a red flag, right? That there's something else going on. And so families oftentimes, I know even with mental health, they're not aware of access to a speech and language pathologist. How do families even access this type of service?
Accessing a speech language pathologist can be very direct, or it can be, some families find us through a variety of ways. Some families find us after referrals from their pediatrician. A lot of times is me walking through the hall, seeing other kiddos, and then a parent or a daycare teacher saying, "Hey, I have concerns about this little one." Um, but also, like I said, it could be very direct, like contacting a practice within your area, talking to the speech pathologist at your child's school or daycare center, and seeing what resources are within your surrounding area to find services. And at that point, the process could be started for enrollment and getting evaluations and things of that nature to start the process of getting those needs addressed.
And even like just like mental health, speech and language, most places take insurance these days. So
Mm-hmm.
I talk to parents about eliminating the barriers. They're like, oh, well, we have
Yeah.
to pay for it. No, that's what insurance does. You have a copay and you pay for services. You might be the specialist rate, but
Right.
you can
Yeah.
still use your insurance for services like this. And then thinking about, because you mentioned even school and daycares,
Mm-hmm.
um, speech and language, I guess it doesn't just happen in an office setting. Talk to me a little bit about that piece of what you guys do.
Yes. So throughout my day, I enjoy the movement so much because I get to visit so many sites throughout the day, and even throughout the week is even more. But I see kids at their daycare centers. I have kids in the preschool sites, in our office clinic here in Greensboro. Yeah, I've gone into homes. I've had opportunities where families have met me in the park that they love to go to every week. And so that turns into our speech therapy session.
And I love that, especially for kids who always feel like they have to go to doctors or services and the
Hmm.
flexibility of like, this is a service that can come to you. And
Yeah.
it's a service that even in like in a school setting, for example, they're doing it maybe with other kids because you can have
Yes.
individual group or group sessions when it comes to speech. And so I love that you pointed out like earlier, parents should be listening for the noises and the sounds, even kind of
Hmm.
language. You said cognition earlier. Tell me a little bit about what maybe parents should be looking for cognition type things.
I think at that age, and in those early stages of cognition,
Mhm.
some of the things like I mentioned before with awareness of surroundings or response to different, if they respond differently to a yell versus a random noise outside or something changing in the environment. When I said cognition, I was thinking a lot more about even some of the older kiddos that I've worked with. Um, it's been a while, but older kiddos, sometimes we think about executive functioning and targeting goals along those lines. So And with adults, that's an area as well. It's so many areas of interest.
Mhm. Well, and then, one of, as a mental health therapist, primarily children and families, this is one of the people that I always have on my speed dial, right? Like, I always tell people, like, I know where the speech language people are because they do help, even when I have young ones that come in and maybe there's emotional dysregulation and their,
Mhm.
behavior concerns that are extreme. And the first thing I'll say, well, if I listen and talk with them and I hear language, the first thing I'll say is, let's get a speech eval. And
Yeah.
oftentimes within, 2 to 3 months, even working with speech, all of a sudden now we see that emotional regulation piece come in because some of it was processing. Like they
Mhm.
were feeling things, but they couldn't communicate. They couldn't get
Yeah.
it out fast enough. Like even in school settings, right? The other kids were beating them to being able to say things. And so we don't recognize, though, I think as parents, how much speech is involved in their day to day when they're little, and especially when they're trying to communicate, with us. So when you're thinking about speech, because I know someone would say, "Well, what do they do? Just help a kid talk?" Like, give us some ideas of a couple of exercises. Like, what are some things that you actually do with a student to maybe help develop speech?
Yeah, so with speech, we're looking at the way students are able to produce their sounds. And let's say, for example, I'm best with examples. I'm a visual learner
Mhm,
myself, and sometimes auditory helps me really
mhm,
map things out well. So, a common sound that I work on a lot throughout my day is the k, as in cat,
mm, yeah.
and the g as in go. So a lot of times kids might switch those sounds. So
Mhm,
if a child is trying to say cat, they might say gat. And that would be them adding voicing to the sound that they were intending to produce. So it's a variety of those individual sounds as well as strings, or I should say patterns of phonological errors. So those sounds that it's a trend in the way the child is producing.
mhm,
So we evaluate for speech sound disorders. We treat them, provide all the supports that can be carried over into all of their settings, whether it's at daycare or at home, to help improve their intelligibility.
No, I love that because again, we I always say to people, and even listening to you with the terminology, I'm like, I don't even know what she's saying, y'all. I'm just saying it's
I'm
great.
so sorry.
No, no,
Please
no,
ask.
it's wonderful. No, it's wonderful because again, this is your field, this is what you study. But the fact that we tease the baby that doesn't speak correctly instead of
Yeah,
getting them help, right?
yeah,
Like I just want to call us out as parents, right?
yeah.
Like that could be an indication of something else if they're not pronouncing
Hmm.
the words correctly and things like you said, even like the gat versus the cat, like that
Right.
says, hey, there's a language piece here. We might want to get that checked out. For some of us,
Yeah.
we continue to tease the babies because they don't make their words right.
Right. Or
uh-huh.
even I see a lot of families, it's like, oh, it's so cute when they say it. It is. And at a
Exactly.
certain point,
Yeah.
I know we don't want to accept it and it's adorable, but just paying attention to those developmental milestones, doing a search and looking up some
Yeah.
verifiable sources on those milestones can help a lot,
Mhm.
and seeing if it's just cute and appropriate or cute and inappropriate at this
And we need to change it,
time.
right? We
Yeah.
need help, right? So tell us about Sound to Soul because this is
Hmm.
something in that vein that you were saying. Hey, parents really need to really have more awareness and resources. Talk to
Yes.
us a little bit about that.
Yes. So the idea of Sound to Soul started when I was in grad school. So I did a big project with some of my peers within my cohort, as well as an independent project where I was able to present on the role that speech pathologists have on the school to prison pipeline. And
Wow.
so that, just being able to go through that gathering of information and resources and supports in that area, in something that is not talked about as often as it should be, it just, I guess, opened up a new world within the field for me. So,
Okay, now hold on, Lyric. I'm gonna have to stop you there because I love talking about the preschool to prison pipeline. That was part of my dissertation as well. Okay, so what did you guys find out? Give me like a nutshell of your research. What did you find out? How does speech impact or that school to prison pipeline?
yeah, there's lots of cases. I could talk about this all day long, probably more than a day. But there's lots of instances where there's cases that people who have been suspected of and or diagnosed of cognitive or speech and language delays have been in situations that they may not have, or it may not have had the same outcome that it would if the parties involved in making legal decisions or giving legal advice were aware and cognizant of their conditions, or they had the access to the services to be able to, get some intervention and therefore not lead them down certain systemic pipelines, and hence the term a school to prison pipeline.
Yeah, and we find that even in the mental health space, like how many people within prison systems have diagnosed mental health conditions that were treatable, and did that, if they had gotten treatment, would they be in prison, right? We talk about that with the preschool to prison pipeline. So sorry to get you off track there, but I think it's fascinating. Another element that even speech and speech differences could also play a part. And I could see that for the kid that, for example, has speech and language and everybody's making fun of him at school, and they disconnect from school even, right? And now we know that disconnection from school leads to delinquent and other behaviors. So absolutely. But Sound to Soul came from this graduate project. All right, keep going.
So when I went through seeing how many, because there are programs that are out there addressing this issue and looking at ways that services can be provided to kind of mitigate the outcomes that we're seeing along this research and everything. So once I recognized that, hey, there's a lot of impact that speech pathologists can have. It's a lot of places and a lot of areas where there's just not enough information. And if it is information, sometimes it's not accessible. And so there was born Sound to Soul, which is just a platform where I just aim to educate, empower families, inform, just bridge the gap between the clinical knowledge and what I'm doing in my everyday practice and with the kids that are already enrolled in services to those who are at home and they're scrolling on Instagram and they see a post and it's like, I do need to see if my child needs services or might be having delays that are not appropriate for their age.
And I love that because community resources, even around the education piece, you just blew my mind with the speech of the preschool to prison pipeline, because I'm just like, I know so much about it and I never thought about speech. So now I'm just like, I got to do some research.
It's so many ways.
Yeah, no, listen, it's deep. That's why community programs like Sound to Soul is so important, because here is one small piece that we could say, hey, is preventing this youth from a different outcome, right? Like the idea of prevention, and we talk about community supports. And I would have said, I don't even think about speech. Obviously, as a mental health therapist, I think about speech because I pick up on how children sound when I'm even trying to do mental health evaluations or our mental status exam. You listen to speech and language and you have to give an assessment of that as part of your evaluation. But as a parent, thinking about when my children were little, I was listening for the oohs and the gahs and the babbles and all that. I mean, in my mind, ruling out autism and other things, but even pronounce words, but even you said picky eating, right? Like these are the things. Yeah, a lot of the times. I mean, this is my 2 to 5-year-old population. My chicken nuggets and mac and cheese eaters.
Especially when it's having those nutritional impacts.
Mm-hmm.
There are other professionals that we definitely collaborate with in that area, but feeding disorders is a part of a speech language pathologist scope of practice.
Yeah. And again, I usually do dietitians. Now I will send for speech and language because that was something that I just learned to do. Listen, and all my time in working with children and families, I've been sending them to pediatricians and dietitians, but even right now, speech and language.
And so definitely not my primary, but yeah, there
but it ends up being right in that piece, and that's what I like too. And even I know pre-show we were talking, and you're saying your heart, even with Sound and Soul, is really to just help parents and to help people to understand, and the idea that language is so much a part of education and schooling. I think about the child that may have a stutter, or a child that has difficulty with speech and language when it comes time to reading out loud in school, and what that moment feels like and what happens. I know I work with children with social reciprocity when it comes to autism, and I always say it's like the tennis ball, right? If the tennis ball doesn't go back and forth about language, then that's usually what I'm listening for, right? Is there the back and forth? There is always just one-way conversation. And typically that's when I can tell, even with young children, that it may be time for an autism evaluation based off their speech.
Yeah.
They use pronouns, and if they mix up the he, she's and things like that, if they say my brain instead of my thoughts, like language and speech is so interesting when we start to listen to that.
It is.
When you think about how long families tend to stay in treatment, I know it's kind of based on different, whatever the underlying condition or reason, right, for the speech concerns. But typically, how long should a family engage in speech and language?
That question is kind of a tricky one. Like you said, it is a lot of variation that comes from the type of disorders that the child may present with, the severity of them, but it also is varied upon different treatment strategies. So there's a lot of strategies that can be used to target certain particular goals and areas of need for a child. And so as you work with the therapist, you're getting your just information, you're gathering connection with that child and with the family as well, and figuring out what works best. So that can take some time. And then there's other factors that make it hard to say if you will be exited within this amount of time or discharged from services within a year. We can't really put a number on that. Unfortunately, it's a common question we get though.
Well, and I know, because even for families, it's kind of like one more service added on. When usually speech, you have other things involved too from a service perspective.
Definitely.
I often tell families, earlier the intervention, the better the outcomes. And that's the same with speech, right? Like the sooner we can get kids evaluated, we figure out what is going on. If there is anything, some things they'll outgrow, some things they need support and help around, being willing to do that. So Lyric, I hate ending this conversation because again, I love talking about the language differences in speech and how we help our babies. But what would be one tip, strategy, something that you would say maybe to a parent that's maybe concerned about language and speech with their kiddo?
I would say primarily that your concerns are not crazy. As if you have concerns, seek a speech therapist, seek a provider to see if you might be onto something, because 9 times out of 10, not an official stat, but most times when a family says, oh yes, I had concerns, those concerns are coming from a place where they are validated by evaluations and services and interventions. So seek services, seek your resources.
Yeah, and stop saying we're crazy, because we're not. Mama, Intuition is right.
Right.
All right, dear. So speaking of laughing here, let's go. We're going to go into our Laffy Taffy. Before I let you go, our Laffy Taffy joke of the show. Proverbs 17:22 says, a joyful heart is good medicine. All right, so you ready for your joke? All right. How do billboards talk? How do billboards talk?
Loud and proud. I don't know.
Good answer. No, good. I like good answer. Sign language.
Oh, that's a good one.
Only because it was a speech and language world. All right, dear.
I love
So,
that.
Lyric, how can people get in touch with you about Sound to Soul? How can they get in touch with you if they have questions about speech therapy? How can they get in touch with you?
Yeah, so I can be found on Instagram and Facebook at Sound2, the number 2, Soul SLP.
I love Sound to Soul SLP. I didn't even realize that. I love it.
Yeah. Oh, you know what? It's actually .slp. I'm misquoting my own name.
I do
Sound
too.
the number 2 Soul .slp.
I love it. Awesome. Well, before we go, we went to our Love Our Babies Well segment, and today we really talked about the idea of speech. Even in the Bible, Moses was concerned about his speech when God called him forth. But we have to remember that speech is a huge part of how we communicate. And parents, as Lyric said, you're not crazy. If you hear it, we want to get our children help as soon as possible. Early intervention helps to, as we learned today, prevent even the school-to-prison pipeline for kids. Speech is that important. Thanks for tuning in to the Dr. Stacy Show today. Until next time, keep the faith, love the babies, and pursue wellness.